All right, so we are the laser therapy group. My name's Bailey Taggart.
And I'm Kayla Houston.
Natalie? Lesley.
And I'm Danielle.
All right, so we're going to go into just a tiny bit about what laser therapy is. It's actually an acronym that stands for light amplification from stimulated emission of radiation. It's basically a light that's monochromatic, so it's just a single wavelength of light, and it's in a coherent pattern so that the waves all kind of cohesively flow together. And the wavelength of that monochromatic beam determines how far the light can penetrate into the skin, and that also helps determine which class of laser it's considered.
So, looking at our thoughts and biases on this modality, just like prior to learning about laser in this class, I didn't really know that it was something that physical therapists could use. And it kind of seemed a little bit flimsy in sense of like, it doesn't seem like it'll do a lot of like help you very much. And then after doing all the research, that kind of seemed to hold true. The research is very conflicting, and it really just doesn't seem like this is a very effective modality, and that there's more effective physical agents that you could use to improve pain and inflammation.
Um,
Go ahead, Kayla.
yeah, going back when I was shadowing in clinics before PT school and all, only one therapist had actually like used light therapy, and she like swore by it, but like all the other therapists that I was with never used it. I just think that there's better way to manage pain and wound healing and things than light therapy. Yeah.
And then I had seen laser used once on one specific patient in my time as a PT tech. Um, they were using it to try to help with diabetic neuropathy, but I never saw a difference. The patient never reported a difference, and even the physical therapist who was helping with the treatment, like who had prescribed it, was not sold on the idea. We only were really doing it at the patient's request. So I kind of went into this from a standpoint of thinking that it wouldn't work.
All right, so looking at the research, overall, there was a lot of conflicting evidence in the research. A lot of the trials were not of the best quality, usually about medium to low, meaning that they really did not include proper control groups, or they only compared laser against ineffective physical therapy treatments. And so it wasn't really looking at the ability of laser to treat things. And then they don't have controlled standardized parameters that are very clearly outlined for different kinds of conditions. So they don't say, oh, you should use this level for this amount of time for a tendon versus this level at this amount of time for knee osteoarthritis. And so there's a lot of difficulty in the research for therapists to say, hey, this is what I should use to see if this is actually effective. And so all this variability makes it really, really difficult to study laser. And then it also makes it very difficult to just kind of compare it to other modalities or physical therapy in and of itself.
And I think something I noticed in the research is that a lot of the treatment programs were done on rats for the most part. Like it's pretty new stuff. And so they're doing a lot of animal studies on it first. And so even if they came up with a good parameter or something, it doesn't directly correlate to humans. Like it's a different size of creature and different areas that you would have to cover, where laser is such a small application device. It seems like it would be really hard to kind of correlate that to using it in practice.
Yeah, and then the research was also pretty inconsistent. There were like a couple saying that it was useful and others saying that it wasn't. So then I don't know, kind of what are you supposed to believe?
And then just for some of the treatments or the conditions that it was predominantly used on and investigated was neck pain. So we found a couple of articles. One said it doesn't really do much. And then a couple of other systematic reviews said, yes, it can help to reduce neck pain and dysfunction in people with chronic neck pain, non-specific neck pain, and then people suffering from whiplash. The whiplash study was done with high-level therapy, though, and the rest were done with low-level laser therapy. There was some research backing its use in Achilles tendinopathy, so a chronic tendinopathy, and they said that it found to reduce some pain and increase some function, so increased dorsiflexion. And then the last one that it was really found to be somewhat useful for was knee osteoarthritis. There was one article that said it didn't really do much to improve pain and function, but it helped improve the person's walking ability. And then two other articles were able to find that it did increase function while reducing pain and also decreasing the amount of cartilage damage within the joint. So these seem to be the top three areas that laser is mostly used, would be for neck pain, knee osteoarthritis, and then tendinopathy. There were a couple of other articles that would look at wound healing, but again, that was on human skin cells in a petri dish, which doesn't always translate well to actually trying it on a patient. There was some rat-based models on decreased inflammation, but again, not really done in a human, so it's kind of difficult to tell if that's really going to be effective in human models. There was one or two on its effects in lymphedema, didn't really seem to help reduce edema. And then one in elbow tendinopathy or lateral epicondylitis, and it did help to reduce some pain. So again, it's just a bunch of different conditions with not a lot of research behind its use in each condition. And the top three, again, being neck pain, knee osteoarthritis, and just tendinopathies.
I think also we can add into that is that the control groups weren't, like there wasn't a control throughout all of these. So they all use different parameters. So having a consistent parameter would probably help with future research.
Yeah, for sure.
Yeah, personally, I'm interested to see how, like, because the premises is like heating up the tissues and stuff. So I would have liked control groups with heat packs, see more groups with heat packs and other heating modalities.
Yeah, that makes sense. Just to compare the difference on the effects of laser versus those kind of heating modalities to see how effective it is. All right, so now looking at this next slide, we kind of just wanted to talk about what it actually entails to have a laser machine. These things can be pretty pricey, so they range from about $150,000 to $45,000. These medical grade machines are really expensive and really big and probably not available to most clinics. The $150 ones are probably just the small handheld ones that are just kind of more easily usable. But then again, we don't really know how effective those can be. The benefits of laser, it's said to help with pain management, neurological conditions, lymphedema, arthritis, inflammation, and soft tissue and bone healing. But again, looking at the research, there's not a lot of articles that actually back up certain things, particularly like soft tissue and bone healing, since these seem to be done mostly in rat and animal models or just human cells in a petri dish. There's not a lot of information on lymphedema, some on arthritis, but particularly knee OA. And then a lot of articles, again, state that it helps with pain and inflammation, but some of the inflammation models also come from their attempts to try it on rats. Again, there's no standardized time. There's no standardized parameters for what you should use for different kinds of conditions. So They say short sessions lasting several weeks seem to be most effective. And often the studies that were most effective were when they were when laser was combined with effective physical therapy treatments. Again, laser therapy is only effective in relieving pain and facilitating return of function in very specific populations, and it's not very consistent across the literature. As far as the space that these machines can take up, they can be really compact, just a small handheld device, or relatively large, usually the medical grade ones, about the size of an ultrasound machine, so they can take up a lot of space. And then reimbursement for using laser on patients, it just depends on insurance in the state. So Medicare and Medicaid will pay a small amount, and then it just depends on what insurance company and if they cover that. So there's no guarantee that you'll get paid for using that, and there's no guarantee that it'll actually really help your patient.
So once we had kind of talked it out, I think all of us are on the same page in we're not recommending this treatment modality. As it stands right now, there's just not enough research, and the research that has been done is in just pretty small populations. We would use it if it were available and the patient had requested it, or if maybe the patient needed a new treatment that they hadn't had before, that they didn't have like previous biases against or something like that. Arthritis is kind of the most promising population currently, but personally, I'm not going to spend the money on buying a laser to try to figure out the parameters to use on my patient, kind of trial and error, and have it only help with pain modulation at best. Thoughts from anyone else?
Yeah, so like when I was going into this, I didn't know anything about laser at all. I've never even heard of it used for physical therapy. So when we do it now, like after doing all of the research and everything, I think there's so many other modalities with actual research to back it up that is in everyday physical therapy clinics that we could use, that we do know that there's benefits for. So I think that's a good thing to keep in mind as well.
Yeah, I think just piggybacking off of Danny, I think that there's a lot more efficient ways to treat my patient versus buying this expensive machine, maybe getting reimbursed from it, and then, you know, possibly being helpful. So I don't know, I just don't like the ifs. I'd like more guaranteed. But there still needs to be a lot of research done in order to convince me. But yeah.
And if I can, I'd like to say that I feel like the field as PTs really pride ourselves in getting the human body back up and going with pretty much just the human body and exercise. So if the best that it can do is pain reduction, I don't want my patients to fall into this habit that I need to come to PT to get that laser or else I'm going to be in pain. So I want to encourage that exercise is the answer.
Yeah, I think that's a really good point, Lesley. And then again, just like we also pride ourselves on being evidence-based practitioners. And currently there's just not enough evidence to support that this is actually going to be really effective in treating more than like one kind of patient. So until there's more research, I really honestly don't feel like this is something that I would use in the clinic, because I feel like it'd be more of a waste of time versus doing something that's actually proven to be effective.
I think those are all really good ideas. And Lesley, that point you brought up about like dependency on the laser, I think is really, really good to consider. We shouldn't have anyone become dependent on laser as a treatment modality. And everybody had really great thoughts on probably not implementing it at this stage. Any last things that we want to say?
I don't know, just based on all the research, laser just doesn't seem to be that effective, and we don't really recommend it as a treatment in your physical therapy practice. And we recommend that you find better evidence-based modalities to use to improve pain and functioning in your patients.
Perfect.